Why Victoria? Why are we in this mess and nowhere else in Australia is?
The jurisdictions that never had community transmission can open up and can ease restrictions to the fullest extent possible, really. If you've got no transmission, it doesn't matter if you've got 100,000 people going to a stadium, there is no virus to spread. And so the easing of restrictions in jurisdictions that never had community transmission or had very, very little community transmission that was snuffed out during the significant restrictions across Australia can open up now without a concern about it. And so they've really got local elimination that allows them to do the easing of restrictions without a concern about cases taking off. For Victoria and New South Wales in particular, the risk remains. New South Wales has probably gotten down to extremely low levels. They might manage that through a test and trace because they're talking about 1 or 2 cases only. For Victoria, we got down to extremely low levels, but any easing of restrictions when there are still chains of transmission there allows it to tick up. That's exactly what's happened.
But so why did they have, I guess, less community transmission given their caseloads were higher? What's unique about this in particular?
It's hard to say. The populations where the virus gets introduced into is part of the challenge, and if it persists in any one cohort of the population, then it's still here. And as you lift restrictions, it can take off. New South Wales have been lucky in some respects. I think I've flagged that it might be the colder weather in Victoria that's allowed persistence on surfaces, persistence in the air. That's been noted internationally recently, that the virus simply survives longer in cold and humid environments, and so that might have played a role in Victoria. But whatever the case is, we can't lament it, the fact that we've got it, and we need to respond.
Just going